The South African Health Products Regulatory Authority, or SAHPRA, has said that it will allow controlled access of ivermectin for the treatment of COVID-19. Earlier this week, SAHPRA also said it would provide protocols for the use of the drug in the coming days. Now, the regulatory authority says by controlling the access of this anti-parasitic drug, it will ensure that it is used properly and will also limit the black market. So joining us now to talk about it, we've got Dr. Boitumelo Semete Makokotlela, the Chief Executive Officer of the South African Health Products Regulator. Good to have you, Doctor. Thanks so much for joining us.
Good morning. Thank you for having me.
SAHPRA has made it clear that the position around the lack of scientific data has not changed, but the decision on controlled access was made because we find ourselves in a pandemic with limited resources. Is this the correct understanding, that SAHPRA is still not keen on the use of it due to a lack of scientific information, but it will allow limited use? Why?
Sure, thank you. I mean, there's been, an evolution of data in the last coming weeks. And in our press, we've indicated the latest data that has come forth. And as we get this data, it's very clear that, we are not able, as a global regulatory community, that we are for or against. So the benefits as well as the harms of this have not been clearly demonstrated. And we're saying because we're in this clinical equipoise, we would then enable controlled access so that we can monitor. And the key thing, because of this limited data, we have to ensure that there's controlled access.
Yeah. Well, what do you know are the side effects of ivermectin that we're aware of in terms of COVID-19?
So the side effects of the drug that we're aware of are those that are generally understood. As correctly indicated, this is a drug that's been for many years for other indications. So the side effects when it's utilized for those indications, such as drowsiness, nausea, etc. And that's why it's important that we've got the data, because there hasn't been a clear study that shows us what are the side effects when it's utilized at certain doses that are found to be effective for COVID. So the issue of dosage, the issue of at what clinical stage of a patient you give it to, and therefore what the side effects are, becomes quite important. Yeah. And that's not clearly understood at the moment.
So from again, what we've heard and speaking to doctors, they say that it has been used in the past for humans who've had severe tropical fever, meaning that there is some knowledge of use in humans, but not for the treatment of COVID-19. Is that what the problem is?
So that is indeed correct. This is a drug that's been used for many years for the treatment of tropical diseases. However, there is insufficient data for its use for the treatment of COVID. So, for example, in South Africa, it's not a registered drug for human use. And, probably the reason we haven't had applications for it to be registered here recently is that we don't have a high propensity of these tropical diseases. So, hence it's been made available through Section 21 for those diseases.
I want to play you a video clip, and you obviously are very familiar with Dr. Nasiva Katraba. We interviewed her a week ago, and she was, of course, leading the whole movement to try and get ivermectin made freely available for use for those that have got COVID-19. This is now her response to the latest development from SAHPRA. Let me play it to you and we can get your reaction.
Hi everyone, my name is Dr. Nasiva Katraba, and I'm the one who penned the letter to the President asking him for his trust in the use of ivermectin, and now with the support of over 700 doctors. Yesterday, SAHPRA had a press conference and threw us a bone with a big bone. I have to say it's a big fat bone. I've just got the document that was released now as to how to access this unregistered medicine via the ivermectin Controlled Compassionate Use Program. And I have just one word to say, and that is, wow. That's all I can say, wow. I am so disappointed, SAHPRA. Indeed, I am absolutely disappointed. This is nothing more than a Section 21 with added admin. So now, not only do we have to fill in this 8-page document, still pay the 300 rand per patient that we could do last week. I'm still waiting for a response for my two, by the way, and one person is dying, he's in ICU. Now we also have to send them an SMS to say that we've sent this, and then we have to give feedback on every time we use it. So you trust us to give remdesivir. You trust us to give morphine and pethidine, Schedule 8 drugs to patients. Then we don't have to apply with Section 21. But this 40-year-old safe drug that is saving people's lives, you want us to be paper pushers? We're not paper pushers. Come and see what we do. Come and spend one day in a general practitioner's practice and see what we have to do on a daily basis to try and save patients' lives. We don't do admin. We don't do admin. We went through med school. We've done our admin. We see patients. We have earned the right to see our patients the way we see fit. But you guys don't trust us. This is nothing more than an absolute lie and a delay tactic. And only God knows why you're doing this. Please, I'd like an explanation. And if any other doctors can shed some light as to why we have to go through this, please, I am all ears, because now I'm at a loss for words. Anger and disappointment. Those are the two.
All right, so quite a reaction there. What is your response to that?
Sure. So it's quite important for the public to realize that this compassionate use access is put in place for a drug where there's little data that give us confidence about its safety and efficacy for the treatment of COVID. It's a drug where in the country, we don't have a licensed manufacturer to bring in quality product. So what you see, we put in a mechanism to ensure that the product that becomes available to the doctors is a product whose safety we can guarantee. That's why we're saying for the Section 21, it must be procured from a licensed manufacturer, because we must be certain of the quality. We've had anecdotal reports that have indicated that some of the products, what's in there, it's not even ivermectin. So we have a responsibility, and that we're not going to shy away from, to ensure that products that are available in this country are quality products. That's why the first tier says whoever brings it in must be licensed. The second tier of authorization is a health facility can store this product in stock. And that healthcare facility, again, it must be one that is licensed, because when they're licensed, the specific protocols that they comply to. So we're ensuring that at least it's at the point where patients are being treated, so there wouldn't be a delay. So stock can be held there. And then the treating practitioner, because there's so much need for us to get all the reports around how it's being used, what doses are being used, and how are the patients reacting from this. We need to get that data. So it's not a bureaucratic administrative process. It's a process that ensures the safety of our population, ensures that the product that is in the country is a quality product, ensures that if anyone has side effects or if it even works well, the regulators made known of that, so that as we get that data, we're able to review our decision. So it's not a paper pushing exercise. Those doctors that have worked with us in the past on Section 21 are very familiar with this. We've applied this process for remdesivir, and it's going very well. We're getting a lot of reports around the side effects and the efficacy of remdesivir. So this is a process that we've applied in the past. Here we're making it available for compassionate use because there's limited data, and we've listened and we've heard what the health practitioners have said. And this is an interim arrangement to enable access.
So obviously what you're saying is that, I mean, tell me, are there active trials happening right now that could not fast track, but in a safe way, find the efficacy of this drug in the treatment? I mean, are there trials happening?
So there are trials in other parts of the world, and we still are waiting data from that. But also we've engaged with the scientific and the research community that very much aligns and agrees with the SAHPRA position. If you look at what the Ministerial Advisory Committee have said, if you look at what the Essential Medicines Committee have said, if you look at what the National Institutes of Health has said, what the WHO has said, we are all on the same page. Every authority, regulatory authority, every strong scientific authority is on the same page, saying the same message about this drug. Yeah. In the country, we've engaged with the scientists, and we're expecting that there'll be clinical trial submissions quite soon, and which will be great for us, right? Because we have to generate this data under properly designed clinical studies.
Which is important because, you know, it is, as many people have been saying, it is a cheap drug that can be used and is available. So this is something that is very, very important if, in fact, it does get the thumbs up in terms of the different studies. My problem is here, and it's a big issue, and I think we need to address this, is I alone have been offered ivermectin from different people, and I don't know what it is. I don't know what they're offering. They're just saying, listen, we can get the stuff, so, you know, would you like a box? And, you know, this is the problem, and I'm not the only one. I'm sure that there are many, many other people that have been offered and have been victims, perhaps, of something that isn't ivermectin being sold to them. This is a great concern with speaking about it so much. How are you controlling this? I mean, what do we look out for? And what do you advise people that have this and want to self-treat even at home?
Yeah, and that's why this program needs to be applied adequately, because the concerns that you raise of this product being available in the black market is what we've seen, and our law enforcement team are working hard to, you know, address that issue. I mean, we saw a few weeks back the consignment that we were alerted to by Port Health in Durban, where we had someone who was not licensed, a businessman who just brought in this product. Now, we don't know what's in that. Even though it's written ivermectin, you are not certain, because this is someone who is not licensed that we can hold accountable. So hence, this is a Schedule 3 product, right? So if you do access it, it has to be under prescription from your healthcare practitioner. That's the only way you can access it. If it's available off the shelf, etc., that is not correct. You will not be certain of the quality of that. And that's why our first tier of the Section 21 request is we want a licensed manufacturer to bring it in. Because if they bring in product that is substandard, we will hold them accountable. We've got mechanisms, and thus we can ensure that whatever product that the doctors are prescribing, it's a quality product. So anything else, and that's why in the Section 21, they have to tell us where are they getting this product from, so that we can ensure it's from a licensed manufacturer.
Yeah, I see our time, and I know that we have to wrap, but I have to ask you about the vaccine. And I mean, I can see so many people on about ivermectin, and a lot of medical professionals saying here, you know, by the time they review the application, the patient will be dead. That's Shamim writing to us. Another person. Never mind, I'll leave the profanities, we don't have time for that. But what I do need to ask you is about the vaccine that's arriving in the country, AstraZeneca. There was a report doing the rounds yesterday which was quite worrisome, saying that it may not be effective in people over the age of 65, and also big problems with delivery from AstraZeneca's side. Where are we with this? Are you still satisfied that AstraZeneca is the way to go for South Africa?
No, thank you. And I mean, as a regulator, we're not involved in the logistics part of it. It would be the Department of Health, and you saw on the webinar that they had and other stakeholders. What we can say is that the product that we've authorized has demonstrated safety. And as we indicated, one of the things that we will be looking for, again, there'll be a reporting mechanisms. So very clear that with all these Section 21 authorizations, we always insist on reporting, right? Because we need to track how these products do. So it's not unique for ivermectin. Even with the vaccine, we indicated that we've got a MAD safety app that would be available where the vaccinees will report when they experience any side effects. And that's how we will monitor it. But also working with the department, we'll be able to monitor whether anyone who then takes the vaccine gets the infection again. And there's a protocol that's been put in place that will study those instances. So we will be able to see how it's performing in the prevalent strain in South Africa, and also seeing if there's any side effects. So that will be, you know, ongoing work. I know that the research community is busy now with analysis of these vaccines against the prevailing strain. So there's a lot of work happening in that space.
All right, we leave it there. Thank you. Thanks for your time, Dr. Boitumelo. We know we needed to have this interview and have this discussion. Dr. Boitumelo Semete Makokotlela from the South African Health Products Regulator, talking to us about the decision to facilitate a controlled, compassionate